Gaimuth, and welcome everyone. My name is Riaz Danani, and I will be moderating today's Fields of the Future speaker series, Exploring Public Health. A little bit about me professionally. I work as lead corporate counsel at CarMax headquarters in Richmond, Virginia. I am a board member of AKEB for the Northeast, and I am also a Fields of Future team member. The Fields of Future speaker series is hosted by the Aga Khan Education Board with the aim of exploring career paths, innovation, and opportunities in selected fields of the future. As for today's edition, we will begin by reflecting on knowledge society for the purpose of education in Islam. At this time, I would like to invite Ali Punjani, our Fields of Future team member, to share this reflection.
Yalam everyone, and thank you, Riaz, for that introduction. Welcome to the second of 10 Fields of the Future series. My name is Ali Punjani, and I serve as the Fields of the Future Speaker Selection Team Member for the Aga Khan Education Board for the United States of America. At each Fields of the Future event, we hope you think about your role in the knowledge society. Are you pursuing your curiosity and research in the Google rabbit hole? Or are you sharing and building on what you've learned with others? Maybe you're asking yourself questions like, why do I care about this? Why don't I care about that? Fields of the Future goes beyond career planning. We hope you find something that can inspire awe, curiosity, and creation. Before we immerse ourselves into public health, the transferable skill of today is interpersonal communication. Interpersonal communication helps us turn a conversation into an opportunity to keep building a relationship. At the Aga Khan University, Karachi in 2006, His Highness said, "The spirit of the knowledge society is the spirit of pluralism, a readiness to accept the other, indeed to learn from him, to see difference as an opportunity rather than a threat." Interpersonal communication is how people share and exchange their information, feelings, and meaning through verbal and nonverbal messages with each other. Sometimes we can get used to talking at or to people instead of with. Sometimes our conversations don't go the way we thought they would, especially the difficult ones. The next time you have a scheduled conversation, put yourself in your colleagues' or friends' shoes and think about these questions. How will my colleague or friend feel about this conversation? How is this different than what I had anticipated? What is their point of view here? And how can my body language and words better convey my thoughts so that I am heard without ignoring their point of view? Now, I would like to hand it off to Riaz to introduce our speaker for this afternoon.
Thank you, Ali. Now that we have an introductory understanding of some of the relevant concepts and how they relate to our faith, let's meet our speaker for today. Alicia Lalani is the Vice President of Business Strategy at Magellan Health, a national health plan for Medicare and Medicaid recipients, where she is focused on innovations to reduce cost of care and improve member experience for low-income populations and individuals who need long-term care and other specialized services. Prior to this, she supported government program growth strategy and product development with Evolent Health, a company focused on value-based payment models and hospital systems. Alicia was also previously with United Health Group, where she consulted with state Medicaid agencies and supported their implementation of state insurance exchanges and other Affordable Care Act provisions. Alicia received her Bachelor of Arts in Women's Studies and Global Health from Emory University and her Master's of Science in Public Health from Harvard University. She currently serves as the chairperson for the Aga Khan Youth and Sports Board for the Northeast region and has held various leadership roles for Camp Mosaic over the last 15 years and Global Encounters since the program's inception in 2012. In order to suit this program best to our audience, we'd like to get a better understanding of who's joining us today. So we request you guys to complete the polls that popped up on your screens if you haven't done so already. And while you guys are completing that, I'd like to encourage our audience to ask questions throughout the session. You can do that by using the Q&A function of Zoom and entering your questions there. Our team will be noting down the questions during the presentation to be asked during the Q&A portion of the session later on after Alicia is done with her presentation. And now, with further ado, our guest speaker, Alicia Lalani, will speak to us about her career path, new opportunities within her field, and how this field will evolve in the future. With that, I'd like to hand it off to Alicia.
Hey, Riaz, thanks so much. And thank you all for having me this afternoon. As Riaz mentioned, I'm a healthcare strategist focused on innovations in care and the finance of healthcare, specifically within government-sponsored healthcare programs such as Medicare, which is for seniors and disabled populations, and Medicaid, which is for lower income populations. And so while I work on the business side of healthcare, I really focus my career on the most vulnerable populations in the US, those facing significant behavioral, mental, physical health issues. And this is not something that I thought I was going to grow up and do. 15 years ago, if someone said, oh, are you interested in being a health strategist? I probably thought you'd be making that job up. So my journey in public health did not start with this end in mind. And there were a lot of really exciting and sometimes random twists and turns. So I'll be talking through that during this presentation. But what I wanted to do was start with a quick foundational understanding of what public health is first, and ensure we're all working off of the same baseline. Then I'll briefly touch on my journey and those twists and turns. And finally, I'll share with those interested, what is the future of public health? What are the innovations that we're seeing? And what are the key critical skills needed? And how do you get involved, or how do you start that pathway? Or if you're already within public health, what are some exciting pivots that could happen? And hopefully we'll leave a good amount of time for some discussion and Q&A at the end of this. So if we can go on to the next slide, let's start with the first question. What really is public health? Public health is a huge domain, and it encompasses so many subject areas, jobs, companies, types of things, and that's because public health is a huge mission. Public health is meant to promote and protect the health of people and the health of communities, but it's looking at it at a structural lens. So beyond the individual person and the body, it's looking at communities, schools, access to food, transportation. So it's really promoting health where people are working, where people are living, where they're learning, and where they're playing. While public health impacts the entire globe's population, many public health initiatives and most public health initiatives are really focused on those vulnerable populations: children, those in lower socioeconomic statuses, marginalized individuals, disabled individuals, etc. The goal of individuals and organizations working in public health is really to improve the access to and the quality of care and reduce cost and really influence policy at a macro level to optimize care. And so that still sounds pretty broad. And so what I want to emphasize here is public health is incredibly interdisciplinary. So while it's rooted in science, it's also very dependent on policy, on business principles, communications, marketing, data analysis. All of this works together to create public health and to create what public health officials do on a day-to-day basis. So if we go to the next slide, many times public health gets confused or conflated with medicine. And while both are focused on the health and well-being, there are some distinctions. And for parents here who are wondering, hey, is my kid in public health going to actually end up in medicine like my parents wondered for 5 to 7 years? There's opportunities and there's ways that you can cross work in both, but there are some distinctions. So let's talk about that. Primarily while doctors are managing healthcare at the patient level, they're trying to understand the specific issues, the anatomical concerns of what that person is going through. Those that work in public health are really focused on broader healthcare trends, of communities and how their structural issues of their socioeconomic status, their built environment, are impacting their health. And so the schooling for a career in public health versus medicine is different. You can see here how different it looks, but there's many people who've gone to medical school that now work in public health primarily, and there's many individuals who are practicing physicians that have a background in public health, because there are so many interrelated pieces here. If we take an example of a big public health crisis now, or if we talk about the opioid crisis and the prescription drug addiction facing a lot of Americans as an example, let's talk about the difference between what public health does and what medicine does. So a doctor will treat the physical health issues related to that person, right? Their intestinal bleeding, their nausea, their weakened immune system, their withdrawal symptoms, things like that for that individual person. A public health official will focus on the structural issues of how this came to be, right? Overprescribing by physicians and pharmacies. They'll be thinking about the mental health causes and the environmental impacts, job loss, et cetera, that may lead someone to have an opioid addiction. So in that way, those are a little bit of the differences. But in the end, both industries are focused on the healthcare for individuals, whether it's at a macro or micro level. So if we go to the next slide, I think most of us are keenly aware, especially these days, of how dominant public health is in our everyday lives. Public health has actually turned our lives upside down for the last year. But even pre-pandemic and pre-coronavirus, public health was everywhere. On a given day, I would say 20 to 30% of headlines were public health related or public health adjacent. Over the last year, those headlines have probably been about 80% related because it's been coronavirus coverage. But the point here is public health is mental health. Public health it's COVID-19, it's substance abuse, it's vaping, it's police brutality, because it's impacting vulnerable populations, because it's causing long-term implications and healthcare implications, and it's changing communities, and it's being aided by structural issues. So it's really vast in what we're talking about in public health. And if we go back to that opioid crisis example, the opioid crisis impacted middle America, many of whom were struggling with job loss, isolation, and that's politically and economically driven. And so what we're thinking about the health implications or the rehabilitation or the treatment programs, that's healthcare related. And we're thinking about the broader impacts of the legality and the justice system within the opioid crisis. That's a structural issue and sometimes a racial issue. So obviously there's a lot of different ways that you can tackle public health. And there's a lot of different focus areas and where you can go with public health. And as we go through this presentation, I sort of want to share with you, I had a different focus area coming into public health, and that shifted. And so how are we as public health officials taking these big issues and dealing with them in a focused way? So if we can go to the next slide, I'll share a little bit about my background, and then we can go into public health and the focus areas a little bit more. So here, I just want to give you a glimpse of my exploration and journey in public health. And I particularly want to talk to you about sort of what's been my guiding principle at every step of the way and the lessons I've learned. I know there's a few of you here in high school. So if we want to start at the high school side, the lesson here is pick a few interest areas, do what's exciting to you and do them well, but also think about the skills you're developing in those extracurriculars. Are you learning public speaking, leadership skills, time management, et cetera? And that's what you should be taking away in your high school life. And when I went to college, I was pre-med, like many other freshmen around the country. And so my first semester, I signed up for a few of the pre-med requirements, and a couple of things happened. One, I was really bad at them. And for the first time in my life, I was getting terrible grades. And two, I just wasn't happy. I didn't enjoy the classes. I was generally miserable. And it was just not a fun first freshman year or first semester. So my second semester, I decided to take classes for fun and take more classes in my chosen major of women's studies. I took a class called Third World Feminism and Reproductive Rights. And that became one of my first pivots into public health. I'd always been a feminist and was keenly aware of and never afraid to call out gender inequities. However, when I realized how gender inequality impacts access to care and the actual health of women, particularly in developing countries, my guiding principle changed. And my guiding principle then became, I want to improve the status of and access to health for women around the world. And that guiding principle really dictated my next few years. I ended up graduating with a degree in women's studies and global health. I took internships at Feminist Women's Health Center and the Georgia Commission on Family Violence, where I researched the intersectionality of intimate partner violence and HIV/AIDS. And while those were domestic focused, I knew I wanted to get on the field and the field experience. So I went to East Africa in a rural village in Tanzania, and I taught women's groups about HIV/AIDS prevention. And I also did HIV/AIDS testing and counseling. And each of these experiences took me out of my Georgia bubble and put me in situations that were really exciting and sometimes scary and often uncomfortable. And when you need a security guard to walk you to and from your car every day at a Georgia health clinic, or when you're living in a village with no electricity or running water in East Africa, you learn things about yourself and you learn a lot about what excites you. And I had never felt so much purpose than when I was working to advance women's health and access. And really on the ground, you could see the women I was talking to were going to the clinics and they were getting tested. And that gave me so much purpose. So I decided I wanted to continue that in a more formal way. And I joined the Aga Khan Foundation in DC, where I worked on programs and global health programs focused on child survival and infectious disease all around the globe. And I really learned a lot about how global health programs were created and implemented. So I knew I felt most alive out in the field. So I knew, I wanted to continue my career in global health. And so to advance my career, I knew I needed some qualitative and quantitative skills. And so I applied to master's in public health programs and enrolled the following year. And when I arrived at Harvard, I faced two other big issues. One, the professor that I had followed along, had read his research and hoped to take classes with, who had studied women, intimate partner violence, HIV/AIDS, he left and went to a different school. I went to UCSD to start a department there. And then I learned too that the program itself and the university itself was very domestic focused. And I wanted to learn global health. But we spent a lot of time talking about the US healthcare system, the policies that shaped it and the changes that were coming. This was around the time when President Obama was rolling out the Affordable Care Act. And so there was a lot of conversation and a lot of excitement. But these two big issues also led to big pivots in my career. And so the first was when I realized that this professor, Dr. Silverman, wasn't there. I tried to figure out if I could, fit my interest areas and, into other classes and other professors. And I didn't have a lot of luck. But one day, Dr. Silverman came back to Boston to give a talk. And I was able to speak with him after and had a few questions, shared with him the research I had done on intimate partner violence and HIV/AIDS. And that led to a few conversations and ended up, he said, a PhD might be in your future. This sounds like something that's really of interest to you. Why don't you come research with me over the summer at UCSD, start your PhD research, and then next year when you're done with your master's in Boston, come and start your PhD with me. So the plan was set. I thought, great, yeah, that makes perfect sense. This is research I've been wanting to do for a long time. This is exactly who I wanted to study with. And so I went to San Diego and started my research for my PhD that I would start next year or the following year. My research then was focused on reproductive and sexual health of female sex workers in Tijuana. And I really loved doing the focus groups and being on the ground, just like I did when I was in East Africa. But then most of the time I was sitting in a windowless room doing research and writing. I didn't love that. I felt kind of isolated and I felt like I was missing the action. And I realized a PhD is a lot of that, right? It's studying, it's self-work, and it's a lot of writing for many years. So I realized, this plan was laid out, but this pivot wasn't for me. So then I went back to school in the fall and began getting more and more interested in what was happening stateside. You know, the Affordable Care Act or Obamacare was shaking up the entire healthcare system. People were beginning to focus on quality and cost, especially for marginalized populations. And so I accepted a winter internship at the CDC, where I worked in Jackson, Mississippi on a project about low birth weight babies and the structural issues impacting those women who were having those babies, and they were living under the federal poverty line, and they faced a lot of issues beyond just their health. And so this was my next pivot. You know, what I saw in Jackson, Mississippi was not so different than what I had seen in Tanzania or in Mexico in terms of the health of women. And given this, and given the changing environment in the US, I decided to shift my focus to domestic healthcare, and particularly Medicare and Medicaid, you know, government healthcare that's really focused on those disenfranchised populations. So after graduation, I went into healthcare consulting. And candidly, right, when I was weighing options, consulting was very different than what I thought I would ever do, but I also had a lot of school loans to pay at this point. And so consulting paid a little bit more, and it was still in my interest area. So that's what I did. And I worked with state agencies, you know, standing up new Affordable Care Act provisions, insurance exchanges, and they're expanding their Medicaid coverage. And since then, I've continued down the path of working in Medicaid, and I've worked in consulting, I've worked in corporate strategy, and I've worked with as a service provider to Medicaid insurers, you know, as Evolent, as Optum when I was there, and now I am part of a Medicaid insurer. And so I've worked on different sides and different facets of Medicaid, and I've really focused on building my Medicaid expertise and continuing to find new angles and growth opportunities in the space. And so I think while my guiding principle has changed slightly over the years, it's foundationally remained the same. And that's been my North Star. So while it took me from, you know, being in a mud hut in East Africa to working as a consultant or in a very corporate, you know, American job, I've been able to stay true to that mission and that guiding principle. And so I think the lessons that I would take away is plans will change, pivots will happen, and sometimes those pivots work out and sometimes they don't. But don't be afraid to take the long shot, and there's always lessons learned from different twists and turns. And that's what I learned. You know, I think 15 years ago when I started this journey into public health, I never thought that I would be in a corporate role. And I think, you know, my family always says, this is not what we expected of you, but I've been able to find a role that still speaks to that guiding principle, and still allows me to have that impact on those in that disenfranchised population. So if we go to the next slide, and you guys can, you know, we've talked about this a little bit now. You know, I started in global health, it was very different, and I ended up in healthcare management and policy. And there's a number of different focus areas in public health that people go into. And so what I wanted to talk to you a little bit about is, how do we take those big structural, big healthcare issues, and how do we actually focus in it and get work done? And so there's a number of focus areas here that I want to talk about, and what they actually mean, and what that means for potential future career goals. So if we start at the very left of epidemiology, that's actually the study of the disease origin, where it's coming from, how it's being spread, how contagious is it, and if it's chronic, what are the underlying concerns? So if you're working in epidemiology or you're an epidemiologist, you might be working at the CDC, you might be working at a research institution, the WHO, et cetera, to really understand where this disease is coming from and how it's being spread. If you're working in environmental health, you're thinking about, of course, the climate change impact on healthcare, but also what are the inherent work and school and community issues impacting your health, right? What are health concerns for construction workers when they're, you know, working on the field? Is it respiratory issues, injury issues? For individuals who are in office jobs, what is this stress issue related to your healthcare, and how are we dealing with that? And so if you're thinking about working in environmental health, you know, you can work with government agencies who are thinking about this on a regular basis. They're the ones who are setting healthcare standards for restaurants. They're the ones who are setting healthcare standards for development for a bunch of different things. So it's government agencies. There's a ton of big companies that also are focused on the environmental health impact, whether it's mental health or physical health within their companies. There's think tanks associated with climate change. So there's a lot of broad things that you can do in environmental health. In biostatistics or data science or genetics, this is really focused on how diseases develop, how they progress, how they spread, what's the mortality rate look like, and you're really using heavy quantitative methods and data analytics and understanding trends. And most of the time, biostatisticians are working in research firms or hospitals or larger companies or governments, but really, they're really working in the data. And then global health, right? We talked about global health a little bit, but people who work in global health are developing, implementing, and monitoring healthcare programs that really impact those marginalized populations around the world. So this could mean maternal mortality, childhood nutrition, HIV/AIDS, et cetera. And I think this is, global health is what people think of when they think of public health, right? They see the images of developing countries and people, building wells, things like that there. And you're thinking about the AKDNs, the UNICEFs, the USAIDs. That's really where global health happens. And so I think that's probably one of the sexier public health focus areas. And it's where I started. And population health, as we think about what that means, it's really healthcare communications, it's interventions at the community level. It also includes mental health, it includes social and behavioral science. So if you think about like the Got Milk campaign or the Stop Smoking campaigns, that's all population health related. And so you could be working at government agencies or marketing firms or community health centers, because all of that is really population health and community level health. And then, where I am now, healthcare management and policy, that's really how healthcare is administered or how it's delivered. Whether you're working in a hospital system or an insurance company, you could be working in corporate strategy, you can be working in finance, operations, marketing, communications, administration. And so this is really the business of how healthcare is delivered, and this is much more domestic focused. So there's, like I said, lots of opportunity and lots of interest areas and exciting areas in public health. I wanted to give an example of what each of these actually do in a real life example. So if we go to the next slide and we talk about COVID-19, I think that's on everyone's mind. How did public health work in the COVID-19 situation? So let's start again with epidemiology. So epidemiologists really started focusing on what was the disease origin, where did COVID come from, what are the symptoms that we need to look out for, who are the high-risk individuals, what are the long-term impacts, how is this being spread? That's all epidemiology related, and that's what epidemiologists were doing. The environmental health folks and those officials were working on, what does this mean then for our schools and our workplaces? How are we protecting those individuals in the spaces that they're learning and they're working? Do we need new ventilation systems? Do we need to think about spacing? All of that came from environmental health folks. Biostatisticians were thinking about the contagion trends, the impact on comorbidities, the morbidity rate, and how is this impacting, and what does that mean then? What are the trends for the economy and things like that? So that they were really, again, looking at that data and trying to understand what this means. What are we thinking about? How many people is this going to impact in the end? The folks working in global health were trying to understand the global health trends and understand what are the impacts on the vulnerable populations. Is this going to impact a certain demographic more? Is this going to impact a certain country more? The population health and mental health folks, again, we're thinking about the community level impact. How is this going to impact a neighborhood? How is this going to impact socioeconomic status? How is the isolation going to impact mental health for individuals? And then lastly, the healthcare management and policy folks were thinking about the administration of extra care, right? When the hospitals were overflowing, how do you manage that? How do you manage now the administration of vaccines and the payment of vaccines? And so all of these different focus areas, while they're very different types of work and very different types of people working in this, they all work together to understand one big issue and and they all are working together, using each other's data, using each other's models to figure out how we, as a collective, work to address a big issue. So if we go to the next slide, I think what we talked about in each, right, is each focus area kind of has different technical, qualitative, and quantitative skills. And so depending on what area you're focusing on, there could be software or quantitative skills you need in stats or logistical regression if you're really working on the data. If you're working in writing, I think many people will need writing and proposal or grant writing or communications or PowerPoints. But I think the soft skills are incredibly important in public health. And we've talked about this a lot, right? It's incredibly interdisciplinary. And, you know, Ali gave a great example at the beginning of this conversation about interpersonal skills and the ability for somebody to have a conversation and engage with many types of different people who are optimizing for different things. So in my day-to-day role, you know, I have to talk to the data and IT people and really understand what they're optimizing for. They're really focused on the data, but then I have to go talk to the clinical team and understand, okay, they're really focused on the member and the health outcomes. And then I have to take all of this and give it to the executives, and they care about the finances in the end. And so how do you code switch between different folks who are optimizing for different things and looking at different data elements? And how do you work to make sure that they feel you're on the same page and you're able to have a productive conversation with them? So those communication skills, those teamwork skills, that's all really important. And the ability to take all of this just different information and synthesize it in one space, I think, is also incredibly important, especially if you're working in a field like public health that is so interdisciplinary. So I think some of these skills are, you know, they're relevant for many different roles, but I think especially in public health. Next slide. So what's next in public health? What are the exciting things that are happening? You know, the big innovation that was happening when I started my journey was the Affordable Care Act or Obamacare, and that was really changing the entire way we think about healthcare. And that big innovation changed my career trajectory. So what are the big other innovations that are coming down the road? And I think I wanted to show here a couple of different cool things, right? So there's generally, like many industries, healthcare is becoming more consumer centric. Even, you know, there's companies that are dedicated to specific diseases or conditions, whether that's substance abuse, mental health, diabetes, oncology, et cetera. And, you know, healthcare is also discovering that there's a lot of places outside of hospitals or provider offices to deliver care. And many companies are figuring out how to bring healthcare to the consumer in a way that's convenient for the consumer. And you know, one of my favorite things and one of my favorite innovations that I've seen is the social determinants of health. And that's really come to the forefront as a leading cause of poor health outcomes and higher healthcare costs. And you know, this means how the social determinants of health are: how does your education, your income level, where you're living, your transportation ability, how is that all impacting your actual healthcare? And so hospitals and doctors and insurance companies are really taking stock and finding ways to address these social factors and how they connect to an individual's overall health. You know, now when you're seeing physicians, they're screening for individual needs, their safety, their food, their housing, their income stability, and how that's going to impact their ability to take medications on time and see physicians if they need follow-up care. You know, for example, insurance companies and companies like mine are working with Uber and Lyft to help members get to the doctor so that if they don't have transportation or you know, when transportation was shut down during COVID, they can get to their appointment on time and they're not facing adverse health reactions because of a transportation issue. You know, doctors are also writing prescriptions for healthy foods. So we all know sort of how diets are impacting our health. And for people living in food deserts or people who are living under the federal poverty line, the ability to get those, you know, fresh fruits and vegetables is really difficult. But now doctors can write a prescription for a healthy diet, and you can take that to a food pharmacy and you can incorporate that nutritious diet into your lives. And so that's been a really big shift in the way people think about healthcare in the US particularly. And lastly, and I think it's a bit of an obvious one, but certain types of technology have really enabled us to reduce the gaps in care. You know, many of you may have had your first telehealth visit during quarantine, and this is a huge boon for healthcare. To be able to get even primary physical and behavioral health care and prescriptions from wherever you are is revolutionary for healthcare. You know, overwhelmingly, even lower income populations have smartphones. So to be able to use mobile app technology to remind people of medications or to help them get to their doctor, you know, really allows for better compliance and ultimately better health outcomes. And so what I wanted to show here was some of the big trends, but also some really cool companies doing cool work in each of these spaces. So if anything is piquing an interest to anyone here, these are some great companies to check out. And many of these some of these have been around for a long time and are very large companies. And some of these are startups with less than 100 people. So it really ranges. And I think that's what's so cool about healthcare. You're seeing a lot of companies that have been around a while really changing and innovating, and also new companies coming in and pushing, pushing the status quo, which is very exciting. So finally, the last slide, what are some steps you can take to get into public health? And I think the bottom line here is do your homework, because there's just so much here. You know, I've put in some exciting, podcasts that I listen to, some news spaces, and then some folks I follow on Twitter, which is good to just get sound bites of what's going on in the healthcare world. But as you're thinking about a pivot in your career, or as you're thinking about getting started in public health, what is the focus area that you're interested in, right? Public health is so large. What are the few that you're interested in? Obviously, people switch and move back and forth, but what are the few that you're interested in? What are the jobs that are out there? What exists out there? Is this something that's of interest to you in the long haul? What does the job look like? Understand where you are and what you need to learn, and then start looking things up, and then find out what jobs are available, what companies are of interest to you, and if they're not hiring now, what have they hired for before, and really trying to figure that out. And of course, I think everyone has talked about networking, right? So that's incredibly important. But when you are networking, I think there's some surefire ways to make it successful. When you're reaching out, make sure you are reaching out with a specific ask. Give your name, your interest areas that you're trying to understand, and make sure the person you're reaching out to knows that you're serious, whether you explain that you're in the field already and you're looking for a shift, or you've done your research and trying to understand, or you've narrowed down your focus areas. And then ask for 10 to 15 minutes of their time to just have an informational interview. There's so much that you learn just by talking to someone, just to understand, hey, what does your job entail? What does your company look like? Are there jobs in this space or this focus area? And continue to have those conversations and ask them if they have folks that they suggest that you talk to, who might be able to connect you to something that's of interest to you. But make sure you're spending the time and doing the Googling, but also having the conversations with the people that you think are, either working in the space directly or tangentially. But like I said, public health is it's a really exciting time. Obviously, it's never been more in our faces than it is now, but there's a lot of cool things coming down the pike. There's a lot of different focus areas. There's a lot of different ways to use the skill sets that you have if this is something of interest to you. And so it's been a great journey for me. I really love everything everything I do and everything I read in this space. And so hopefully there's folks out there who are interested in that, but I'm happy to answer any questions or talk about it or have some discussion here. So I appreciate you listening to the long spiel here.
Alicia, thank you so much for sharing your field of the future today. I genuinely enjoyed hearing so many opportunities in this field. It's amazing. You talked about epidemiology, healthcare management, data science. There's just so many opportunities in this field. I have to mention, one of the attendees spoke about how your causes have been such a true inspiration. And I speak for the group when I say I absolutely agree. So thank you so much today. Now, everybody, I just wanted to remind you that we're going to have our Q&A section right now. And so make sure that you use the Q&A function to ask questions. And there's actually a like button, so that'll kind of make questions that maybe you see a question that you also wanted to get answered. Make sure that you hit that like button, and then it'll rise up to the top, and we'll make sure to get to as many as we can. And so with that being said, let's start Q&A. Alicia, so this question comes from somebody who has been in an admin role for 10 years, thinking to change their career into healthcare, but want to know, would a healthcare aid course, how would that serve and benefit them?
So if I'm hearing correctly, an admin role is probably on the business delivery side of healthcare, and a healthcare aid. I guess the question is, what is it? A personal care aid? Is it actually a clinical aid? And is that what you're looking at? If that's the case, I think there's a couple of ways that could help, right? One, it could get you on the ground, and if being in the background and working in the background of healthcare is something that's been not as exciting, but being on the ground and seeing that immediate impact and working with patients and members is of interest to you. I think a healthcare aid role gives that to you. But also, if you at some point you want to go back to a back end role, having that on the ground experience of understanding how specific policies impact an individual on the ground, and really understanding those top level decisions and what that looks like on the ground is really going to be beneficial to anyone, right? When we have a lot of nurses and folks that we work with who we seek business advice from because they've been on the ground. So I think that on the ground experience is really helpful, and it is also for you is good to get that mission driven excitement and being on the ground with a member.
Awesome. One thing that a lot of our questions are going to, everybody wants to know, what is a day in the life of Alicia Lalani? What does it look like for you? What do you do on a day-to-day basis? I think that would be really beneficial to our attendees. Sure.
Yeah, that actually, I think everyone will say every day is a little bit different. But I think on a, let's say on a week to week basis, a lot of my role, I'm in a corporate strategy role. So my job is to understand how are some of these innovations going to impact our members. And so what I'm looking at on a day-to-day basis is, what are the costs that the business, my company, is incurring from these members, right? Like I said, these are really vulnerable populations. They sometimes have behavioral mental health concerns. They are living in poverty. They have immigration issues. They have long-term supports that they need for a number of reasons. So trying to understand broadly, right, what are the costs that we're facing with that member? What are the healthcare issues that they're dealing with? And then taking that and understanding the trends of, okay, we have a market in New York. So in New York, we're seeing, a spike in individuals who need meals. The social days have closed because of COVID. There's no congregating. So what are we going to do to fix that? So we look at the trends, we look at the numbers, and then my role is really to find what are the companies that are providing meals to populations and that can deliver meals in a safe way, and we can get our members nutritious meals. And so that's something that I will vet companies with, meet different companies and figure out, hey, can we work with you to get meals delivered to these individuals? Similarly, on the digital health side, right, we have folks who can't leave their hourly jobs to make their way 2 to 3 hours to get to the doctor. They can't get there because of transportation issues or childcare issues. So can we get them set up with telehealth or give them a smartphone to have those meetings with their physicians or get their prescriptions? And so a lot of my job is understanding the trends, both in terms of how people are utilizing care, but also what that cost looks like, and how can we find innovations to both increase the quality of care and also reduce our costs as a company.
Excellent. We have a lot of attendees that are kind of starting their journey and kind of wonder about education. And so I'm going to pair two questions that I'm seeing into one.
Sure.
So Did you take any business classes in school? One, and then two, if somebody was majoring in business, what would you say would be the most useful major in business for their field? So whether it's like admin or marketing or finance or whatever it might be.
It's a great question, and this is something I always tell folks is I wish I had taken more business classes in school. I didn't, and I think it's a couple of reasons, right? I thought I was going to do global health. I thought I needed more programmatic data analysis classes, but day to day, I really need those business skills. And so that's been a lot of learning on the ground and learning in the job. But I would definitely recommend for individuals who are interested, especially in healthcare administration and management, to take those business classes, particularly finance and accounting, actually, because I think it all sort of gets to being able to read a balance sheet and understand a P&L. And I think accounting and finance give you that. And I think the other things you can really figure out on the job, right? Because it will be very job specific.
Yeah, absolutely. So another question, and this one's very specific, but I think that it would be nice to get into this. So do you think that telehealth will exacerbate the opioid crisis?
Okay, interesting.
Kind of a softball question there, sorry.
No, that's okay. I think there's a couple of different ways to think about the opioid crisis, right? I think the opioid crisis came about in a lot of different ways, and a lot of it was understanding the prescription trends and what people were going in for and how much or how little people need. I think given the now awareness of the opioid epidemic, given the awareness of some of the impacts of things that, drugs that we thought were a little bit more harmless than we thought, like oxycodone, all of the, those drugs, I think there's a lot more restrictions around opioid prescription. And so even in a telehealth setting, a physician's ability to prescribe that is really limited given the new regulations that are in place. So I think no, just given some of the new laws that have come out, but I'd be happy to have a dialogue about it and learn a little bit more.
Great. A lot of our attendees are also asking, what are some of the challenges that you faced in working in corporate healthcare?
Okay, there's a lot, right? There's a lot of different challenges. I think a big one, and when you think about corporate healthcare, especially big companies like United Health Group or Optum, a lot of healthcare companies look like other large Fortune 500 companies. It's very male dominated. It's very homogenous in terms of racial makeup. And so, in one of my jobs, I left a position and went to a different position. And then the person who took over my role actually got paid 3 times more than I did. And I only found that out because I was friendly with the finance folks, and they had mentioned to me. And I think, those things continue to come up because and I think we're seeing this reckoning across the US, right? Is people are treated differently based on gender, race, et cetera. And I realized in that company, I was going to hit a ceiling because I wasn't a particular race, because I wasn't a man. And so I needed to get out of that company. But that was really evident. And that was something that, sure, I had read about in my women's studies classes and gender studies classes, but experiencing that in a really tangible way was difficult. And I think, the other big piece is, again, learning. And the other hard part is, if you're someone who's very mission driven, right? I've always wanted to be focused on vulnerable populations and working with them. Corporate America is sometimes not so fluffy, right? They care about the bottom line, the margins, the finances. And so to be able to push your agenda, but also make sure you're meeting shareholder expectations, I think was a little bit difficult for me. And I had a little bit of a moral quandary of, am I doing the right thing? Am I a corporate sellout, right? I've had all of these conversations, and because I was working global health, that difference was even more stark. But I think, I've been able to find that even in these corporate environments, you're able to find those people who are really mission driven, and they're really the ones who are pushing the work. And you can't have a company, a corporate company, without the finances, but you also can't have a corporate healthcare company that's not focused on the healthcare and the good. So I think it's making sure you're finding out and surrounding yourself with the people who feel the same way you do.
Okay, we have a question, and I think that this could work for a lot of our attendees. So this person specifically is a clinical provider and oncology pharmacist, but they're looking to switch into public health in their field. So can you talk more about transitioning into public health, and how does that overlap with global health?
So I think there's a couple of different ways, right? And depending on if you're working in clinical oncology, right, what kind of public health do you want to do, right? Do you want to focus on the data? Do you want to do programs? And I think any kind of clinical background is valuable for folks in public health, right? Again, you understand the science behind oncology, you understand how it's going to impact patients, you understand the macro situations dealing with oncology. So I think a clinical background is always going to be helpful in public health. It's a matter of what you're going to be interested in doing, right? If you're going to focus on the data piece, it's, what are the quantitative skills you need? What are the specific programs you need to learn? But if you want to work on the policy side, right, how do you take your clinical understanding and bring it up a notch to understand what are the trends and what are the interest areas? And I think even at the global health level, right, what is the global health community's interest in oncology? What are the things that they're seeing there, and how do you take what you've learned here and bring that there? And are there companies and organizations that are bridging that gap, right? So it's understanding sort of what you want to do in public health and figuring out, are you able to, one, bring up your knowledge if you want to do more policy business, or two, if you want to do more data, do you have those software skills and those quantitative skills?
Great, and another theme, a big theme on a lot of our questions have been education, and so here's another one. We have a person who's a nurse practitioner who provides healthcare with a full scope of practice, and they're looking into programs to get a doctoral degree as a nurse practitioner, but they'd like to know how a master's in public health makes them more well-rounded. What is the scope of practice for them after a degree completion?
Yeah, again, similarly, right, having the clinical background is so invaluable in a public health setting, because you're able to see at that micro level the patient and the individual's experience, and understand, again, the science and the hospital administration and the drug prescription, all of that stuff you've seen at the micro level, and you understand it a little bit differently than the folks in the business realm. So I think a degree in public health, for example, really, again, helps you bring that clinical knowledge and that on the ground knowledge up a little bit. How do you synthesize that? How do you understand trends, right? You're working with individual people every day, but how are you then taking that, building out the trends, understanding what are the macro level implications of this? How do we synthesize this? What is the financial implications of this? So a public health degree sort of helps you take those bigger concerns of trends and finances from your experience, and you're able to bring that up and speak to it at a higher level than just on the ground.
Great. We have an attendee that's asking, how does public health align with social work? So how similar or how different are those two fields?
Yeah, it's a good question. I actually think that there's a lot of similarities. I think social work encompasses public health and it encompasses healthcare, but it also encompasses a number of different spaces, right? It encompasses housing, it encompasses family issues, it encompasses emotional distress, it encompasses education. social work is a very large field as well. My understanding of social work, again, it's similar to medicine in that you're working case by case. You're working with individuals. Social workers have a panel of patients or members that they're working with, and understanding their specific individual needs and managing at the individual needs level. Again, they're probably working on things and structural things that public health folks are working on, just at a more community level. Public health officials usually don't have patients or specific individuals they're working with. My understanding of social work is that they're usually working at the individual level, but working on very, very similar things.
Great. Let's get a little bit technical here. So I've got an attendee. This is an anonymous attendee, and the data is posted from this person, so I can't verify it. But data from Columbia Public Health has recently shown a decrease in 19% of positions available for MPH students in academia, nonprofits, and government, which have been down compared to positions in insurance and the pharma industry. And considering these areas usually do not have as much funding, what is your advice for people who want more experience in these areas after graduating with a degree in public health?
Yeah, I actually hadn't heard that stat before, and so it's a good one. I think that it's true. A lot of places don't have funding. I think other places do, and it depends on where you're going, and your ability to. I don't think anyone should work unpaid after college. I don't think that that's something that you should do. It's how much can you, it's how much do you need to live and understand and work off of. And I think working at an organization that may be less prestigious but gets you the skill sets that you need, right? I think what I've learned in my time is places and big organizations that have a brand name and large, even if you're working in nonprofits, they're more likely to do unpaid internships and fellowships because that brand name will get you somewhere. Other organizations that need the talent are willing to pay. It might not be a lot, so it might be, it might be good to look at secondary or tertiary cities, right, and work in those spaces on a lower salary, but it gets your foot in the door. So I think that there's opportunity. It's just finding, right, if you want to work in a community health center, does it make sense to work in a community health center in New York City? Does it make sense to work in a community health center in Kansas, right? I think it's whatever you're comfortable with and what experience that you want to get from those spaces. But I do think that you should get your worth, and especially in an after college role, make sure you're getting something that's paid. But if you have the ability and flexibility while you're in school or you're doing work study, and you can get internships or fellowships while you're studying, that might not be paid or might be paid differently, take those opportunities while you can.
Excellent. So this is a question that I absolutely love. And I feel like we don't talk about these things enough, and I'm glad that somebody asked it. So how does mental health play a role in your day-to-day life in your field? Is it something that that you focus on, or can you speak a little bit about that?
In terms of my professional role?
Correct. Yeah. In terms of the work that you do, and does it come up and things like that?
Yeah, actually, mental health is a big part of what we do, and actually, you'll see across the country, most Medicaid agencies, most companies are talking about physical and behavioral and mental health together. And so everyone is talking about integrated care. You're not going to find many companies, large companies and large Medicaid agencies that are just focused on physical health or just focused on mental health. There's a lot of interplay there, and so there's a lot of ways that we're working on that. And my company, it is really well known for their behavioral health and their mental health, and so much of what we do and the markets that we serve, it's an integrated offering. So we don't do physical health without mental health, and a lot of what that looks like is, one, ensuring that folks are diagnosed appropriately, and making sure that they're getting the help that they, whether it's therapy, whether it's a health aid, they're getting the support that they need to live their lives in their community. And so what my company does and what I try to do is we make sure that we give folks, even those who have mental or behavioral health concerns, that they're able to dictate what they need. If they want to go into a facility, we're able to manage that. If they want to stay in the community, in their homes, how do we help them and how do we give them the services that they need to do that and to do that effectively, whether it's medication, whether it's support from outside sources, whether it's training their caregivers on their concerns. But it's something that we focus on day in and day out, the same way we focus on physical health.
Great. We actually have a lot of high school and college students and parents as well that are thinking about maybe what fields their student could get into. So wanted to go over, what undergraduate educational path would you recommend after high school if a student was interested in pursuing public health?
So I think that, and I mean, I think not a lot of parents would be happy, and my parents weren't, about me, my undergraduate path, which was women's studies and global health. But I think that that's helped me a lot in how my career has played out, right? Because it's helped me think strategically and analytically. I think in undergrad, you should do something that is of interest to you, but you should supplement it with those classes that you think that you will need. I think, again, those finance, accounting classes are incredibly helpful. Any software that you can learn, take it, right? Those hard skills are always going to be helpful. Your major and in what you want to study mostly, I think that should be something that's of interest to you. But I think that you should, and you have the ability, right? Most undergraduate courses allow you to take these other classes. So make sure you're getting those hard skills. And if that's something that you want to study full time, do it. If it's something that you just need to get under your belt and get the understanding of, do something that you're interested in. And I don't think that, especially in public health, I don't think that there's a specific path that you need to go down. I think, political science, pre-law, pre-med, there's specific classes that you are required to take. That's not the case with public health. So do what's of interest to you, but make sure you're getting some of those hard skills that we've talked about, right? The finance, the accounting, the logistical regression, those math classes, those are all important.
And kind of piggybacking on that, we have a student who asked a question, what's the most efficient way for an undergraduate student to develop better data analysis skills, including qualitative and quantitative skills?
Can you say that one more time, Riaz?
Sure, yeah. So this is coming from someone who, they may be in high school or an undergraduate, but they just want to hone their data analysis skills. So qualitative, quantitative skills, what's an efficient way for them to do that?
I think a couple of things, right? I think if you're an undergrad, there's classes that will be business focused, that focus on Excel, or teaching you modeling in Excel. I think that those are good ways, and I think that those are applicable across different industries. I think if you want to learn a specific software, I think you could do that either in a class, and there's also extracurricular programs, and there's also external programs that are teaching coding or Stata or things like that they do, 8-week sessions or things like that you can learn and you can do outside of the school, and it's a nominal fee that they charge you. But if you want to do just an intro course or a crash course, you can do that within a January semester or a summer semester. But there's also a lot of private companies that teach these crash courses that are only a couple months long, or even sometimes they're like 5 classes long.
So one question that has come up, which is very interesting, is there anybody, so in your field, and someone who does general public health, is there anybody or a role that kind of dips into the different buckets? You had that slide about epidemiology and it had all the different buckets. Is there anyone that kind of, I guess, across the board works on all phases of general public health? Or is there like a job or some type of role that someone has that would kind of function across the board?
They're all really different, but I think the first name that came to my mind was a professor I had in grad school, Dr. Atul Gawande. And so he actually, he was a professor. He had studied the medical aspect. He had created the physician's checklist for public health. And so he worked on the medical side of things. He worked on the understanding how the person is impacted, but then spoke at, and then taught public health that how a physician needs to play, how a physician's role is in understanding the disease origin, so that epidemiology aspect, the mental health aspect. So I think, and now, before, right, he was actually tapped to be the head of the Amazon JP Morgan healthcare venture called Haven. I think that they've since shut that down, but he was going to be responsible for population community health and their new healthcare ventures. So even on the business side, he was working to bring those skill sets to the business aspect and a venture capital aspect. So I think there's people like that exist that have done pivots in their career. I don't know if there's many folks that do that entire spectrum on a day-to-day basis. I would say it might, if they do, it might be academics or people who work in, who have that ability to work in the data, but then speak and then do other ventures on the side. Or if you think of like a Sanjay Gupta, I don't know, who previously did something like that, but now is working on the public health information side and more on the news side, but was really on the ground and understanding healthcare. So I think that's, it's just pivots, but I don't know of many that do that all in one go.
Okay, great. Sticking with our theme, fields of the future, how do you see the growth of public health in communications and journalism in the coming years?
Yeah, I mean, I think this year is a great example of how communications and journalism impact public health. I think more and more we're going to see, and I think communication and journalism just broadly has expanded a ton. People are now very focused on broader community public health issues. I think mental health, the opioid crisis, COVID-19, all of these are big public health crises, and they've all gotten a lot of attention. So I think that there's going to continue to be that interest, and I think people now know that we have to focus on these things, right? Because these used to be things that would bubble up at the bottom and sometimes would spike up when there was an interesting case or things like that. Now those things are coming up to the forefront. And like I said, I think 80% of headlines recently have been public health related or public health adjacent. So I think that there's a lot of opportunity there. It's a journalist and it's a communication specialist's ability to understand the data behind the public health trends and pull that up in a way that's digestible for the masses. And I think that that's really valuable. But I think we're seeing a ton of movement in that direction.
Great. Let's go back to focusing a little bit more on your personal journey. So what's an example of a project in your career personally that you were proud of, or you felt like, it could have been implemented differently? And what did you learn from that experience?
All right.
It's basically like a job interview question, but.
Yeah, it is a job interview question. I'm trying to go through my files and figure it out. So there's been a couple of things. When I was working at a company that it was a provider of services to insurance companies. They wanted to get into the insurance business. And so they wanted to work in Medicaid. So when you want to work in Medicaid, you have to apply, you have to do an RFP or proposal to the state. The state is the one that decides Medicaid funding. So I was brought on to help build out government programs for the company. And so there's a lot of money in Medicaid and Medicare. And so we decided to apply and organically grow on the Medicaid side and acquire a Medicare company. And it was really exciting at the time. I was able to use my government program expertise in a different way and build a company's strategy for their government programs. I think it was something that I was initially very proud of. I think it was bringing innovation to Medicare and Medicaid, both while we were applying for the Medicaid proposal and also when we were acquiring the company. I think the strategy and the execution and the development of the proposal and the acquisition was really exciting and something I was proud of. I think the actual, once we were able to acquire the company, the execution and the integrity of the company, I think diminished, just because in that new company, we didn't have the expertise we needed to really make that program successful. Medicare and Medicaid are very specific and highly regulated spaces. And so it's easy to, get a foot in the door, but to really implement it well and do right by the program is a little bit difficult. So once we acquired the company, we realized that our corporate understanding of Medicare wasn't right. And in the end, the member suffered in the end. And then that's something that I think that we could have done a better job at. And that company actually ended up selling the Medicare company back. So while it was exciting to be at the forefront of innovation for a new company and a company to bring more excitement and change to government programs, I think in the end, having that expertise and making sure that you have the end in mind of that member and that patient, and making sure that there's no abrasion in their care is most important. And so I think that's an example of something I was incredibly proud of, but also in the end wish we had done something different on.
That was a home run answer. I would hire you on the spot. We got a really good question here. So what public health would you recommend for someone who's interested in working in developing countries for women? So like what path would you suggest for someone who really wants to work in developing countries for women?
I think that's the global health focus area, right? I think it's making sure that you, one, understand what it means to work on the ground, right? Work in a developing country, what that looks like, and what are the things that you're going to be doing on the ground, right? Most of the time, you're going to be working with funding from a large corporation or a large government organization. Sometimes it's USAID, sometimes it's AKDN, sometimes it's the Gates Foundation. And what are the programs that they're doing and what are they focused on? And how are they implementing on the ground, and how are they making sure that it's evidence-based, and how are they making sure that they're, again, focused on the right outcomes? And so I would, one, focus on global health and focus on the ability to analyze the qualitative skills more so of understanding the impact of the program on the ground, and also the proposal writing and the communication skill set there is also really important if you're working in development, but it's probably going to be that global health track.
Great. We have a question about, and I know that you come off as a very humble person, I'm sure you are, but you have the Harvard degree, and people are wondering, how has that impacted your career? What does that do for you, having that, having that name on your resume?
Yeah, it's a good question, and I think it opens doors that wouldn't before, and that's as truthful and candid as I can be. I think especially now when people are looking at LinkedIn more so, and people are looking at resumes in a very short time, I think having a degree from an institution like that gives you automatic credibility, whether it's earned or not. That's what I've found. What I've realized though is, yes, it gets you into the door probably easier, and you get into a number of doors. Your experience and your ability to do the work will keep you in the door, or will help you build that credibility further. I think it gives you that first step, but I think the other experiences that you have play a role in the longevity of your ability to sustain that career.
Well, great. That was a lot of fun. I think we had a lot of really good questions. Alicia, is there anything, do you have any parting words or anything that you wanted to say before we kind of move on to the evaluation slides and all the rest of it?
I just want to thank everyone for hanging out for a little over an hour and listening in. And I appreciate the questions. They've helped me think a lot as well. And if there's anyone interested in having a further conversation or engaging, I'm more than happy to help. I think that they'll share my contact information, or you can find me on LinkedIn and send me a message. Actually, a few of you already have, so I appreciate that. But if there's ever anything that I can do to help in this field, please let me know.
Alicia, thank you again so much and I'm speaking for the Fields of Future team and all the attendees. Thank you so much for joining us today and imparting your wisdom, for everybody that was involved. With that being said, I wanted to thank everybody for attending today. We did have a lot of questions about connecting with Alicia, and like she said, you can reach out to her on LinkedIn, and we will be sharing a slide here soon that'll kind of show you contact info. I just wanted to remind everyone of this last slide. So let's put that up, to stay home and save lives. Our institutions are encourage everyone to stay home and continue to practice social distancing and physical distancing, even as we, are improving, thankfully, because of people like Alicia that are in public health. So let's move over to the evaluation slide. Before we conclude our program, we want to request everyone to complete this brief evaluation to let us know how we can improve for our upcoming events. So this link is on your screens, along with the QR code. Additionally, for easier access, we have shared the link in the chat box. So please take a moment to complete that evaluation for us, and that'll help us improve our programs. Okay, once again, thank you all for joining us today. We hope to see you at our event in 2 weeks with Alisha Lalani discussing careers in biomedical sciences. Thank you, and Yali Madad.